As we continue to learn how to give relaxed passive movements, the next joint that we come to is the knee joint. Ideally, knee flexion and extension is performed along with hip flexion and extension. So I've described how to give relaxed passive movements at the hip joint in a separate video. However, I'm going to repeat some part of it here with reference to the knee. So position of the patient is supine lying. Position of the therapist is straight standing. Stabilization till the pelvis is by the patient's own body weight and distally is by the therapist's grasp. As for the grasp, with one hand, grasp the patient's heel and with the other, control the movement at the knee from the anterior aspect such that your fingers reach the posterior aspect of the distal thigh. As you perform the movement, move your wrist and forearm so that your fingers come to the medial aspect of the distal thigh. To reach full range of knee flexion, hip flexion prevents any restriction because of the rectus femoris muscle. To achieve isolated movements at the knee, the patient is in prone lying. However, we can place the upper limbs and the position of the neck according to comfort. The therapist continues to be in straight standing by the side of the patient, and stabilization is by the therapist's grasp. So, with one hand, grasp the patient's ankle from the anterior aspect. With the other hand and forearm, stabilize the pelvis. Perform the movement through the available range and return. So this short and sweet video was about learning how to give relaxed passive movements at the knee joint. I hope you found it useful. We have many more such videos lined up for you.